13 early signs of kidney failure you may be ignoring. Have you ever brushed off swollen ankles, foamy urine, or a constant feeling of tiredness as just part of getting older? Think about it. How many small signals from your body do you dismiss as unimportant, when in fact they may be telling a much bigger story? The truth is that sometimes the tiniest daily inconveniences are actually the whispers of hidden health problems. And when it comes to kidneys, ignoring the whispers can turn into a scream. Today, we are going to uncover 13 early signs of kidney failure that people often dismiss. By the end of this conversation, you will understand why looking closer and listening to your body can quite literally save your life. Kidney disease is known as the silent killer. This sounds dramatic, but there is a good reason for the name. Most people do not realize they have kidney damage until they have already lost 80% of the organ's filtering ability. Imagine living with only a fraction of your kidney power and not even knowing it. Millions of people, especially seniors, are doing exactly that. Tragically, many of them believe their tiredness, swelling, or loss of appetite is simply normal aging. It is not. Ignoring the early warnings can lead to dialysis, serious heart problems, or worse. But here is the hopeful truth. If you catch the signs early, you can take action, preserve kidney function, and often prevent the downward spiral. Before diving into the specific warning signs, let's take a moment to appreciate the kidneys themselves. They are about the size of your fist and they work quietly day and night, filtering toxins and waste from your bloodstream. They keep your minerals balanced, regulate your blood pressure, produce hormones for strong bones, and even play a role in keeping your red blood cell count healthy. When kidneys weaken, the entire body begins to suffer, often in ways that are subtle and surprising. The key is this: your body whispers before it screams. If you learn to listen to those whispers, you can act before disaster strikes. So let us move through the 13 early signs together, one by one, and explore why they matter. The first sign is constant fatigue. Almost everyone has days where they feel tired, but if you wake up after a full night of sleep and still feel drained, that is not normal. Kidneys are responsible for making a hormone called erythropoietin. This hormone tells your body to produce red blood cells, and those cells carry oxygen throughout your system. When kidneys fail, the hormone decreases, you develop anemia, and without enough oxygen you feel tired, weak, and foggy. People dismiss it as age, but it could be a red flag. The second sign is swollen ankles and feet. Have you ever noticed that shoes which fit perfectly in the morning feel snug by evening? This happens because weakened kidneys struggle to eliminate excess salt and water. The result is fluid buildup, especially in the lower legs where gravity pulls fluid down. Many people blame poor circulation, but often the kidneys are the culprit. Swelling can also appear in fingers and hands, leaving rings tight and uncomfortable. Moving on to the third sign, puffy eyes in the morning. If you look in the mirror and wonder why you have bags under your eyes even when you have slept well, it may be because your kidneys are leaking protein. Normally protein belongs in your body, not in your urine. When kidneys filter poorly, protein escapes, and one of the earliest visible signs is puffiness around the eyes, particularly in the morning hours. The fourth sign is foamy or bubbly urine. Your urine can tell you a lot about your health if you pay attention. If you regularly see foam or bubbles in the toilet, similar to beer fizzing in a glass, that could be protein loss. Normal urine should be more or less consistent without excessive froth. Persistent foam means your filters are failing to hold on to proteins as they should. The fifth sign is frequent urination at night. Of course, many people get up once or twice during the night. But needing to urinate multiple times, interrupting your sleep regularly, may not be just an aging bladder or prostate issue. Damaged kidneys lose their ability to concentrate urine, so they let go of water continuously. The result is frequent night trips to the bathroom that disturb rest and quality of life. The sixth sign, and one that must always be taken seriously is blood in the urine. Healthy kidneys keep blood and waste separate. If you see urine that looks red, pink, or even dark brown like cola, it may be blood. This can result from kidney stones, infection, or even cancer. Whatever the cause, it should never be ignored. It is one of the body's most urgent warning signals. The seventh sign is persistent back pain that is not relieved by stretching or movement. Because kidneys are located beneath the ribcage at the back of the body, pain there can sometimes signal problems. Stones, infections, or swelling in the kidneys create a dull, sometimes one-sided ache. Different from muscular back pain, this discomfort does not go away with rest or a massage. The eighth sign is a metallic taste in the mouth. Some individuals notice that food tastes strange, meats may taste bitter, or they feel a constant taste of metal. This happens because toxins build up in the blood when kidneys cannot filter effectively, and taste buds become distorted. Loss of appetite often follows, which is a problem in itself. Number 9 is dry and itchy skin. Kidneys regulate mineral levels such as calcium and phosphorus. When they fail, imbalances occur and waste builds up under the skin. The result is itching that lotion does not relieve. If you find yourself scratching constantly without relief, the cause could be deeper than the skin. The 10th sign is shortness of breath. People are often confused by this one. How can the kidneys affect breathing? There are two main ways. Extra fluid may build up in the lungs, making it hard to take deep breaths. At the same time, anemia reduces the ability of red blood cells to carry oxygen, leaving you out of breath with very little exertion. Climbing stairs or walking a short distance may suddenly feel exhausting. Sign number 11 is poor concentration or brain fog. If you find yourself feeling unusually forgetful, struggling to focus, or mentally slow, it may be from toxin buildup in your blood. These toxins circulate throughout your entire system, including the brain, slowing down thinking processes and making it hard to stay alert. While some memory changes are a normal part of aging, this could point to kidney malfunction. The 12th sign is unexplained weight loss or persistent loss of appetite. When the body is overloaded with waste, food simply stops being appealing. Nausea and vomiting can become frequent. You may notice pounds dropping without trying. Unlike healthy weight loss, this is a dangerous red flag of deeper dysfunction. The final sign is high blood pressure that stubbornly resists control. The kidneys and blood pressure are deeply interconnected. Damaged kidneys lose their ability to balance blood pressure, while elevated pressure damages the kidneys further, creating a vicious cycle. If medication alone cannot bring your blood pressure down, it may be that the kidneys themselves are the missing part of the puzzle. Now let's pause for a recap. Think about how many of these symptoms people brush off every day. Fatigue, swollen ankles, bags under the eyes, itchy skin, trouble concentrating. Every one of these may be your body asking for help. Imagine catching these signals early, getting checked, and protecting your kidneys before it is too late. You do not need to wait until dialysis or hospitalization. Awareness itself is a form of prevention. At this point, you may be wondering what you can do right now, practically speaking, to support your kidneys. First, stay hydrated, but do not overdo it. Many people overcompensate by drinking gallons of water thinking more is better. Moderation is best. Second, aim for kidney-friendly foods such as berries, leafy greens, cabbage, and cauliflower. Third, cut back on salt, processed meats, and sugary drinks that stress the kidneys. Fourth, monitor your blood pressure and blood sugar regularly, since both directly affect kidney health. And fifth, make kidney checkups part of your routine. A simple blood and urine test once a year after age 50, or earlier if you have diabetes, hypertension, or family history, can be the difference between early action and late discovery. So here is my encouragement to you. Listen to your body's whispers. Pay attention to small changes others might dismiss. And if something feels off, have the courage to ask your doctor for a simple test. These tests are fast, painless, and often covered by insurance. The knowledge they give you can protect not just your kidneys but your overall quality of life. If this discussion opened your eyes, I encourage you not to keep it to yourself. Share it with someone you care about and let them benefit too. And if you enjoy learning safe, senior-friendly health tips explained clearly, make sure to subscribe to this channel. We post new content every week, designed to keep you healthy, strong, and independent. And one more thing, if you want to discover the everyday foods that most people never realize are damaging their kidneys, make sure to watch the next video linked on your screen. You might be surprised by what is sitting in your fridge. Now I will leave you with a question. Which of these 13 signs have you noticed in your own life but brushed off as simple aging? Share your thoughts in the comments below. You might just help another person recognize their own red flags.